Welcome to the Comparison Group Podcast. Find me on the Podbreed network of podcasts. Subscribe for free on Apple, Spotify, Google Podcast, Amazon Music, anywhere you get podcasts. Now, for my regular listeners, I know I promised on the last episode I would start by explaining why I consider myself center-left when I criticize the left so much. Why not just be center-right? But this is a special bonus episode. Ooh, a bonus episode. A special, shocking blockbuster of an episode that must be heard immediately. So, the next episode, I'll get into the center-left, center-right stuff. But for now, I have some incredible clips to play for you in relation to COVID and the vaccine. It's a game changer. It's a game changer, folks. I don't know how else to put it. So get your knife and fork, put that napkin under your chin. I'm about to give you something to chew on. Okay, first up is a clip I would be shocked if most people on the left, anyone who's been vaccine hesitant hasn't heard already. Maybe it's made its way around Facebook, and I'm late to the game on this one. I don't know. I have a feeling there are some people who haven't heard it. It's a clip of the CEO of PFIZER in an interview he did with Yahoo News about 10 days ago. Okay? Here's the clip.
Still, the hospitals in absolute numbers are growing much higher in terms of severe disease, ICUs, occupation, et cetera, et cetera. So, and we know that the two doses of the vaccine offer very limited protection, if any. The 3 doses with a booster, they offer reasonable protection against hospitalization and deaths. Against deaths, I think very good. And less protection against infection. Now, we are working on a new version of our vaccine, the 1.1, let me put it that way, that will cover Omicron as well. And of course, we are waiting to have the final results. The vaccine will be ready in March.
What the fiddlesticks did he just say? I'm sorry, I should have told you I use adult language here. Did the CEO of PFIZER just say the first 2 doses of the vaccine offer very little protection, if any at all? I'm going to play it again. Listen closely. I know it's hard to understand him with all that foreigner in his mouth, but listen closely and see if you're hearing what I'm hearing. The CEO of PFIZER is saying the first 2 shots of the vaccine offer little protection. Let's listen.
And we know that the 2 doses of the vaccine offer very limited protection, if any. The 3 doses with a booster, they offer reasonable protection against hospitalization and deaths. Against deaths, I think very good. And less protection against infection.
Yeah, that's what he said. That's what the CEO of PFIZER, did I say it right? CEO of PFIZER said. The first 2 shots of the vaccine offer little protection, if any at all. The booster shot offers reasonable protection. Then he kind of says against hospitalization and death. And then he kind of says, and little at that. I couldn't understand what he said, but I think he said, and little at that. Now, when I first heard this clip, I, of course, had to immediately go and pull it up to hear it in context, because I just heard a snippet, as you heard. So I pulled it up to hear the entire thing in context. It didn't get any better. It really didn't. In context, it didn't get any better. It sounds like he's discussing the Omicron variant of COVID and saying the 2 doses don't work well against the Omicron variant of COVID. That's what PolitiFact says. If you fact check it on PolitiFact, they say, well, it's out of context. They rate it as mostly false. To claim that the CEO of Pfizer says the first 2 shots don't offer protection, they rate as mostly false. And they say it needs context, meaning you have to understand he was referring specifically to Omicron. Well, Omicron is COVID. That's the dominant strain, from what they tell us. 99% of the cases in the U.S. now are Omicron. So that is COVID. He's saying the first 2 doses don't work against COVID if they don't work against Omicron. PolitiFact doesn't rate it pants on fire, which is their worst rating for truthfulness. They don't rate it just basic false, which would be the next rating up. They rate it as mostly false. Mostly false. You want something like that to be pants on fire false, not mostly false. That the vaccine doesn't work against Omicron. The first 2 shots anyway. Again, I understand, meaning doesn't work to keep you from being infected. He kind of says, yeah, it works. 2 shots with the booster works to keep you out of the hospital, works to keep you from getting dead. But even that, he doesn't sound real confident about. If you listen to the clip, if you view the clip, I'll put it up. I'll put it up on the website, www.thecomparisongroup.com. Look at the clip yourself. Tell me I'm wrong. It kind of feels like he's selling that 4th shot available in March. The 4th shot that he says will be specially designed for Omicron. This is what you need now. You need that 4th shot. You got your first 2 shots. You got your booster. Now you need that 4th shot to protect you against Omicron. But wait, for the first 1 million people who get the Omicron shot, we'll throw in a Delta shot for free. Now listen, I'm not turning anti-vaccine on you here. I'm asking the question, are you in favor of mandating a 4th shot? Are you in favor of mandating a booster shot? If that's what we're being told we now need to truly be protected, to have full actual COVID protection is 4 shots, are you in favor of mandating that? Are you in favor of mandating that for our healthcare professionals? Are you in favor of mandating that for our military? Now, we've repeatedly heard people say, I'm not anti-vaccine, I'm anti-mandate. Well, I'm not anti-gun, but I'm anti-bullets. But is that a problem? Because I don't know if one works as well without the other. I don't know if one can be effective without the other. Will the COVID vaccine be effective if everyone doesn't get it? And if everyone needs to get it, does that mean it has to be mandated? And if it has to be mandated, does that mean that every shot that comes down the pike now, we have to be mandated to get? Are you okay with that? In less than 10 minutes, have I moved you even slightly off of the position of vaccine mandates? If you are at 100%, have I moved you to 99%? If you're a reasonable and rational person, I have. I have. Because I don't think you can be reasonable and say you don't have the slightest bit concern about being mandated to get a 4th shot, a booster shot, maybe a 5th shot, maybe a 6th shot. Maybe 1 shot every year, just like the flu shot, would be necessary. But should it be mandated? Should it be mandated? I don't know. And that's why I've moved from, I was never really at 100% mandates, but I've moved a little bit off the idea of vaccine mandates. I find myself saying, leave it up to the organization, leave it up to the company, leave it up to the hospital. And you're essentially leaving it up to the people. Because if your organization mandates that you get a vaccine and you don't want to get the vaccine, go work for another organization. That's the deal. That's your freedom. So I think I've moved to that position, away from federal mandates and leaving it up to the organizations, the individuals. It's concerning to me that we would consider giving people 4 shots of a vaccine without having the data to tell us it's safe to give people 4 shots of a vaccine over a short period of time. And we don't. We don't have the data. I did find one doctor in the Philippines. I didn't pull the clip because I don't know the guy. He seemed reasonable. Didn't seem like a quack. But at the same time, I don't know him. But he said, we need the data. They've given 4 shots to people in Israel, and he says it seems to be beneficial, but we don't have the data. We don't know about longer-term effects of giving people 4 shots of a vaccine, potentially 5 shots of a vaccine. We need the data. It's concerning. It's not concerning to you? You're still at 100%? All right. Let's listen to the next clip from CDC Director Walensky, I believe that's her name, and Dr. Sanjay Gupta on CNN's Jake Tapper talking about counting COVID hospitalizations. Let's listen to that.
In some hospitals that we've talked to, up to 40% of the patients who are coming in with COVID are coming in not because they're sick with COVID, but because they're coming in with something else and have had COVID or the Omicron variant detected.
But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got in a car accident. They're there because,
right.
They bumped their head. And they're being included as in the hospital with COVID. That number seems kind of misleading.
Yeah, I agree, Jake. It surprises me that they have not been able to parse out that data more carefully. I think the data that Dr. Walensky is quoting is from New York State, and we've been following that data as well. And I can show you what we've seen, sort of tracks with what she said. But out of all the patients that are in the hospital, about 57%, these are COVID patients, admitted because of or complications from COVID, 43% admitted for other reasons and then diagnosed with COVID.
What the fiddle faddle did they just say? 43%? That's a pretty high number. Now, this has been alluded to before, but the people who have talked about it tend to get a little crazy with it, tend to get a little extreme, saying all the numbers are fake, all the numbers are not accurate. The case count, the deaths, the hospitalizations. But this is pretty extraordinary for the CDC director, for Sanjay Gupta, 2 very trusted sources of information on the left to say, listen, the hospitalization numbers that we rely on are not necessarily accurate in indicating how many patients are in the hospital with COVID, with problematic COVID. There are people who go into the hospital with something else and are found out to have COVID. That's crazy. Jake Tapper goes on to say, towards the end of the clip, how can this be after 2 years? We can't figure this out, how to count the people who are in the hospital with problematic COVID and the people who are in the hospital with asymptomatic COVID that went in for something else. How is it possible we can't count those numbers separately? The COVID hospitalization numbers are such an important gauge of how we're doing against COVID. More important, in fact, than the number of cases, which brings me to my third clip.
So we have the best testing in the world. It could be the testing's, frankly, overrated. Maybe it is overrated. America has now conducted its 10 millionth test. That's as of yesterday afternoon. 10 million tests we gave. 10 million. And the 10 millionth will go up very, very rapidly. And don't forget, we have more cases than anybody in the world. But why? Because we do more testing. When you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases. They don't want to write that. It's common sense. So we test much more, many, many times. South Korea, you hear about?
Man, I miss him. Crazy as a bedbug. If you test less, you'll have less cases. Common sense. So why are you playing that clip, comparison group guy? I'm playing that clip as a reminder so that I can play the next clip. Listen to this. This is everyone on the left's favorite nerd, Dr. Fauci, with ABC's George Snuffleupagus.
That is the huge concern right now. But are we heading to the point where we should be focusing less on the daily caseload?
You know, particularly, the answer is overall yes, George. And this is particularly relevant if you're having an infection that is much, much more asymptomatic and minimally symptomatic, particularly in people who are vaccinated and boosted. The real bottom line that you want to be concerned about is, are we getting protected by the vaccines from severe disease leading to hospitalization? I'm still very concerned about the tens of millions of people who are not vaccinated at all, because even though many of them are going to get asymptomatic and mildly symptomatic, a fair number of them are going to get severe disease. But in direct answer to your question, as you get further on and the infections become less severe, it is much more relevant to focus on the hospitalizations as opposed to the total number of cases.
So that's Dr. Fauci saying, as we're getting further along into this, and with Omicron, which is so contagious, maybe we shouldn't be focusing on those asymptomatic cases. Maybe we shouldn't be focusing on counting the people who are vaccinated and boosted. Let's just focus more on the severe cases, the hospitalizations. Well, that's kind of what Donald Trump was saying. Not exactly, but it is. It is. It's kind of what Donald Trump was saying. Donald Trump said, hey, let's not count the asymptomatic people. He kind of said the same thing and got laughed at for obvious reasons. But now here's Fauci saying something not exactly the same. I'll admit that. Not exactly the same, but similar. And I'll admit it is different. The pandemic is different with Omicron. But still, it doesn't look good for people in the media to now say, hey, maybe we shouldn't be counting all these cases because it makes it look like there's a lot of cases. I'll give you more on that from the AP. Here's an article from the AP from January 12th, just a few days ago. It reads, for 2 years, coronavirus case counts and hospitalizations have been widely used barometers of the pandemic's march across the world. But the Omicron wave is making a mess of the usual statistics, forcing news organizations to rethink the way they report such figures. Forcing news organizations to rethink the way they report such figures is the problem a lot of people are having on the right. They're saying, wait a second, now you want to change the way you report the figures when we're up over 400,000 cases a week or whatever the heck we're doing now? Now you want to change how you report the figures? Listen to this. This is an article from the Associated Press, by the way. The Associated Press has recently told its editors and reporters to avoid emphasizing case counts in stories about the disease. That means, for example, no more stories focus solely on a particular country or state setting a one-day record for number of cases, because that claim has become unreliable. This is the AP reporting this. This is not some right-wing website. This is the AP reporting what the AP is doing, how they're changing the reporting of case numbers. This is from the article. During its coverage of a Senate hearing with health experts on Tuesday, the case counts CNN flashed on screen were 2-week averages. MSNBC used a variety of measurements, including a listing of the 5 states with the highest reported numbers over the past 3 days. The Washington Post used a 7-day average of cases and compared that number to last 2 days, showing a 56% increase. The New York Times used a daily count in an online chart, yet it also included a 2-week trend in both cases and deaths. Everyone's doing something different. Everyone's reporting the numbers differently. Many news organizations are debating how best to use statistics now during the Omicron surge, but there are no easy answers, the article says. There are no easy answers, and there is no easy way to explain how a trusted news source like the AP is suddenly coming out and saying something similar to what Donald Trump was getting so much criticism for let's stop reporting on all these high case numbers. It's misleading. It's unreliable. Now, I'm not alleging any conspiracy here. Far from it. All I'm saying is it doesn't look good. It certainly doesn't look good if you're suspicious of the media already. And it sure as heck don't help anyone who was already vaccine hesitant because they didn't know if they could trust what was coming from the media, coming from the CDC, coming from the administration. So here's the bottom line. Am I now anti-vaccine? No. Am I now anti-vaccine mandate? Maybe somewhat. What percentage are you now? You can't still be at 100%. You can't be. Not if you admit you're not okay with a mandate for a fourth, fifth, or sixth shot. If you're not 100% pro-mandate, be 99% pro-mandate, vaccine mandate. But you can't possibly still be 100%. Now, before you say, come on, we're never going to get to the point where we're going to need a fifth or sixth shot, let me just play for you a little clip from this very podcast. This very podcast, a clip in which I criticized Joe Biden, Anderson Cooper, CNN for doing a town hall that no one watched because they weren't going to ask any questions that people really wanted to know the answers to. Let's listen to the clip of me saying the questions Anderson Cooper should be asking Joe Biden. Examples of questions Anderson Cooper should have been asking Joe Biden. Let's listen. Town hall, if I'm the host, if I'm the moderator, first question out of the gate, I ask Biden, Mr. President, do you wipe back to front or do you wipe front to back? That's not the question. Get to the question I asked after that. Question 6, what plans has your administration made for a worst case scenario of a new COVID strain emerging this winter? One that the vaccine is not effective against. Are we prepared? Wouldn't you like to see Biden answer that question? I know we're hoping for the best. I know he wants to come to the town hall and pat himself on the back for the great progress we've made so far, but we still got a lot to do. That's great. That's fine. But what are your plans? Tell us what plans you've made for a worst case scenario. If things don't go the way we want, are we prepared? Do we have a surplus of masks? Do we have a surplus of ventilators? What are we going to do about the vaccine mandate causing some shortages in our hospitals, with nurses, with doctors? If there's a surge in the wintertime and we have to lock down part of the country again, what will we do? Are we prepared for that? What are your plans for the worst case scenario? And if he doesn't seem to be prepared, I would call him out on it. And I would say, how is it possible that your administration is not preparing for the worst case scenario? How is it possible that your administration is not being proactive? It's like I had a crystal ball. That show was published October 28th of last year. The show is entitled The Reason I Listen to Conservative Media. That's the title of that particular episode that I said that in. I said it towards the end of the episode. But I don't have a crystal ball. I'm not even that smart. It's just common sense. How can you not be proactive? How can you not be planning for the worst? I asked a question. I wondered why Anderson Cooper wouldn't ask that question, why no one else would ask that question. Everyone's asking it now. The reporters asked him yesterday at the press conference, and Biden answered it, yeah, I should have been more prepared with the test. We should have been more ready with the test. Democrats are criticizing Biden. How come you weren't more prepared? They're asking it now. They weren't asking it then. I was. Think this is fun and games over here? I'm doing a serious podcast. Doggone rootin' tootin'. Excuse my language. Now, lastly, this is a golden opportunity. A golden opportunity for all of us to admit we have no idea what's going on. None of us. The experts barely know. Joe Biden, President of the United States, Dr. Fauci, they couldn't even get it together to recognize, hey, we better plan for the winter. People getting together for the holidays, people traveling, variants all across the globe because everybody can't get the vaccine. We better be prepared for that. They can't even get it together. They can't even predict what's going to happen with this pandemic. So let's all admit, we certainly can't. We certainly don't have all the answers. It's a virus that makes no sense. Some people have no symptoms at all. Some people drop dead. What's up with that? So let the people that you have odds with listen to this show. I don't care if you're pro-vaccine, anti-vaccine. I don't care if you're pro-mandate, anti-mandate. If you listen to this show, let somebody else listen to it. Yeah, you're helping me out, but I think you'd be helping each other out too. I think it's a way of saying, you know what? Who knows? Who knows what to do? Ask those people to give you back that same. Who knows? Who knows what to do? It's an opportunity. It's an opportunity for both of us, both of you, whatever, to say, who knows? Donald Trump made mistakes. Joe Biden has made mistakes. Dr. Fauci has made mistakes. The CDC has made mistakes. The vaccine's not perfect, but none of this is a scam. Some of this stuff can save your life. Dr. Fauci is not enriching himself over this. I think he'd much rather go back to whatever laboratory they found him in and never have to do another interview. Masks aren't an attack on your freedom. Masks make sense. Of course it makes sense. It just got politicized. But of course a mask can help some disease from flying out of your filthy mouth. Of course it can. Let's just admit it. Let's just admit, if you're sitting in close quarters indoors with someone, it's good to have a mask on. If you'll admit that, I'll admit Trump wasn't all wrong. I'll admit Trump was right about the testing. Things look so bad in America when he was president because we were doing more testing than everyone else was doing. I'll admit that. I got no problem admitting that. I've admitted that before. Give a little, get a little. This is an opportunity. This is a golden opportunity based on just those clips I played you. Everything changed. Everything changed. How we see hospitalizations, how we see the vaccine. First two shots, worthless. Worthless. You need the third now. You need the fourth for Omicron now. Everything changed. Everything changed, so why don't we change? This episode is not to beat up on anyone. Not to beat up on people who are pro or anti anything. This episode is to say, maybe let's cheer a little less when Biden gets bad news on COVID. Maybe let's cheer a little less when someone who's been publicly anti-vaccine dies from COVID. Let's cheer a little less for that. We can still yell at each other about plenty of other stuff. But when it comes to masks, mandates, and vaccines, let's just agree on what we know, which is next to nothing. Thanks for listening. That's the show. Follow me on Twitter @comparison_show. @comparison_show. Visit the website www.thecomparisongroup.com. www.thecomparisongroup.com. I will put up the AP article. I will put up the CEO of PFIZER clip. And maybe a couple of the other clips. You can check them out. Don't forget to subscribe to the show. I will put out another episode, probably sooner than later. That was supposed to be this week's episode. How will you know? If you subscribe. Subscribe to Apple for free. Subscribe to Spotify for free. Amazon Music, iTunes, anywhere you get podcasts. Don't forget to rate the show. Leave a comment if you can. I don't think all those platforms allow you to leave comments, but some do. So leave a comment. Give a rating. 5 stars. That's all I accept. 5 stars. You give me anything less than 5 stars, you'll be banned from the show. Thanks a lot. See you next time.